All right, everyone, well, we'll go ahead and get started. Thank you all for joining us today. As a reminder, the full training webinar will begin around 2:15, but we wanted to take a moment to have a quick discussion with the group leaders for tomorrow's AADR and Friends of NIDCR virtual Hill Day. So if you are a group leader, we appreciate you logging on a few minutes early for this discussion. Um, we would like to just go over some of this. We recognize that not everyone has served in a group leader role before. Some of you have, but some of you haven't. So, first and foremost, we thank you for your willingness to serve in this role for tomorrow's event. And we wanted to take some time to just go over the roles and responsibilities of a group leader, how serving as a group leader will look tomorrow, and what you'll need to do to prepare. I'll send this document that I'm sharing on the screen right now around after the webinar today, so you'll have this to reference. But we'll just be walking through it together today. So, what is a group leader? Really, tomorrow you'll have the role of serving as the moderator for your meetings with congressional staff. You're going to have the primary speaking role, and you'll also be responsible for following up both with the congressional offices and the staff that you meet with, as well as AADR's government affairs team. And we'll be happy to go over what that means a little more in depth. You'll see right here that we have some roles and responsibilities outlined on the page for you, but um, we're going to ask that for tomorrow's meetings, everyone logs on to the Zoom rooms about 10 minutes prior to when each meeting is set to start. And that's going to give you an opportunity to meet with the people who will be in your group for that particular meeting. If it's a larger group, determine who will go over or who will have the speaking roles for the event, and kind of discuss the order and anything that needs to be shared prior to getting on the phone with the congressional staff. We're going to ask that you kind of keep an eye on the time. So you'll have that 10-minute start time, but you'll also monitor the participant list so that whenever the congressional staffer does join, that you can start the meeting promptly and on time. You'll have the job of introducing the group, discussing why you're there, providing some context for the meeting, and then turning it over to the others in your group so they can introduce themselves, provide their name, their title, their affiliation. You'll also serve as moderator. That's, as I just mentioned, handling introductions for the group. And we'll go over, we have a kind of run of show that you can use as a reference. You'll also be responsible for making the asks. So, as you may know, in these meetings, we typically have a number of requests that we make of congressional staff. It's really the point of these meetings. This year, our asks are going to revolve around the National Institute of Dental and Craniofacial Research, the CDC Division of Oral Health, and HRSA's Title VII programs. You'll have some materials that you can reference to get those numbers down. But we need you to make sure that the meeting stays on track throughout. So, um, you know, we want to give everyone an opportunity to share about their roles and their experiences, to share their stories, but we have limited time in these meetings. We expect these meetings to last about 15 to 20 minutes, and we need to make sure that our requests are conveyed to staff during that time period. So we'll ask you to kind of keep an eye on the conversation and on the time, and make sure that those requests are made during the meeting. Also, we ask that you kind of keep an eye on things to ensure a smooth meeting. As you know, in these Zoom forums, there's often background noise that can be really disruptive. So we want you to kind of keep an eye on everything. If there's somebody whose background noise is starting to get disruptive, we're going to give you the authority to mute those individuals during the conversation, just to make sure that things run smoothly. And then finally, the follow up, as I mentioned, after the meetings, we'll ask you to be the one to coordinate with congressional staff, send the thank you email. Thank you for your time today. If there were any questions that they had or any additional materials that they requested during the meeting, you can send those at that time. And then we'll also ask you to follow up with AADR's staff, myself and Aaron, who's on the call today, and just let us know how the meeting went. If there was anything that came up during the conversation that we need to know about, so we can follow up with those offices in a timely manner after the meeting. So here's just a very quick example of what a Hill meeting might look like. As mentioned, we'll ask you to open the meeting, thank the staff for their time, share why you're meeting with them today, and then invite other group members to introduce themselves. Some of you will be leading groups with several people, and it's probably not going to be feasible to ask everyone to have a full speaking role, but we still want everyone to have the opportunity to introduce themselves. So we're going to ask that people just share their name, their title, and their affiliation only. This is something that you'll share with them during that pre-huddle. If it's only 3 of you, everyone could have a bigger speaking role. But if it's a meeting of 10, you'll share with them. Everyone can introduce themselves, but we'd like to identify just a couple people to actually speak on behalf of the group today. And also help facilitate the order of introductions so it goes smoothly. In Zoom boxes, everyone is in different places on different screens. So after you introduce yourself, say, Lindsay, please go next. Pretty self-explanatory. Here's a sample script that you're welcome to use. And of course, we want these meetings to feel authentic and comfortable. So as soon as you hop on the phone with staff, feel free to, edit this so it's in your own voice. But my name's Lindsay. I'm here today on behalf of the American Association for Dental Research with some of my colleagues from Florida to talk about why federal funding for dental research is so critical to the work we do and for the patients we support. We have some specific asks for you today around funding for the National Institute of Dental and Craniofacial Research and the Centers for Disease Control and Prevention's Division of Oral Health. But before we start, I'd like to turn it over to my colleagues to introduce themselves. John, can you start, etc. Then we'll ask you to invite group members to speak about their personal experience. As I just mentioned, if it's too large, not everyone can have a speaking role, so designate 2 or 3 people at the beginning of the meeting. Then we'll have you communicate the asks, and it would be great if you could tie those into the stories that were discussed during the conversation by your participants. But ultimately, we just want to make sure the staffers hear those numbers and those requests. We'll then have you invite the congressional staff to ask any questions that they may have. Again, I don't know is a perfectly acceptable answer, so don't feel like you have to answer any questions. We want to make sure that you're continuing to be seen as a credible source. So if you don't have an answer to a question that they ask, just jot it down and send it either to myself or Aaron following the Hill visits. And then again, just the importance of follow-up. Follow up with both AADR and with the congressional staffers. If you would like a template for a thank you email to congressional staff, I'd be happy to send you one. Just follow up with me separately. And as I mentioned, I'll share this document with you also. You have it. We also have a document of Hill Day talking points that will be available on our website. So I'll drop that in the chat. But I want to pause and invite my colleague Erin Morton to speak in case she has any additional instructions for group leaders that I may have missed or didn't cover.
I think that you got pretty much everything, Lindsay. Maybe the only thing I'll add as I was listening to your remarks is contact information for the staffers that folks are meeting with should also be in the calendar invites as they've been invited to the meeting. So if you're looking for an email address to send those thank you notes, those should be there, but you're certainly welcome to reach out to Lindsay or myself if you're looking for them.
So we have a couple minutes before the rest of the webinar is set to begin. So I am happy to pause and answer any questions from those who are serving in group leader positions tomorrow, if you have them.
Hi, this is Erin Booman. I just had one question. I participated in another Hill visit with ASBMR earlier this year, and there was a big social media push. Do you guys have any recommendations on that, or are there any hashtags and things that we should be using for the upcoming meetings?
Thank you for asking that, Erin. Yes, we do. So I will drop something into the chat right now. On our website, we have a social media and communications toolkit. So we have several sample social media messages. Our hashtag is kind of long, but I'll also drop it in the chat. It's AADR FNIDCR Advocacy Day. So those are both in the chat now. And then the other thing that we're going to be doing is tomorrow we'll be sending an email out to all AADR members with a link for an action alert that will allow members to fill in their information, and it'll pre-populate a customizable email that you can then send to your representative. So it's just one more way to push the message. But yes, we do encourage you to post on social media throughout the day. As a group leader, if at the beginning of the meeting, if you want to ask if you can take a screenshot of everyone and then share it on social media, we'd encourage you to do that. We also have on the website a Why I Advocate sign. And we would love if you all printed that out and wrote why you're advocating for dental, oral, and craniofacial research. You can either do that virtually or you can just print it out and write on it. So thank you for asking that. But yes, there's a full social and communications toolkit online.
Hi, I have a question. So
Sure.
I invite for 2 meetings back to back. So I'm not sure how I can start my second one 10 minutes early.
It did unfortunately happen in a couple of instances for scheduling where we had to get them back to back. It was the only option. So what I'll say is, are you serving as the group leader for both meetings? So in your in your first meeting, the best you can to wrap up maybe 5 minutes early so that you have at least a little bit of time to go join your other group in the Zoom room for that other meeting. And it will be 2 different Zoom links. That's important to highlight. So you don't have the risk of having a staff person pop into your second meeting, but you should be able to wrap them up in, as Lindsay said, a lot of times 15 to 20 minutes. So 25 shouldn't be too tough.
Okay. Also, are we getting like a list of our group members, or like, how do we know who's in our group, or how many do we have in our group?
The groups are all included in the calendar invite. So we did that this year rather than sending individual lists. It's not, and people aren't grouped outside of their state. So you're only going with people from your state. Whereas if we were in person, we would lump folks together so that they could go, travel in larger groups. Since everybody's doing this virtually, we did it a little differently this year.
Okay, so I'm looking at the calendar right now, and it's just for both my meetings, it's just me and another person who's on the invitees list. So it's just 2 of us. Okay.
That's the case. Some states have just 1 person sometimes in meetings, and some states have 5 or 6.
Okay.
And since we're a little past the 2:15 mark, we will move on from the group leader training and into the formal webinar training. So we'll get started on this piece. So hello, everyone, and thank you for joining us for the 2021 AADR and Friends of NIDCR training webinar in preparation for tomorrow's virtual Capitol Hill Day. We're glad you could join us today. During today's webinar, we're going to be going over some information to help make sure your days tomorrow go as smoothly as possible, and to make sure you're really equipped with the tools and resources that you need to feel prepared for your visits. We'll begin today by just going over why advocacy matters and why Hill Days are important. We'll review the asks for this year's Hill Day. We'll go over some tips for running an effective meeting, run through logistics for tomorrow, discuss any materials that you need for Hill Day, and then we'll also allocate some time at the end so we can answer any questions that you may have. We know this Zoom format for a Hill Day is a little different than what any of us have done before, so we want to make sure that we provide ample time for you to ask questions. So why we're here today, the mission of AADR is to drive dental, oral, and craniofacial research to advance health and well-being. And our Hill Days really operate with that same mission in mind. It's really important for us as a community to meet with lawmakers, to educate them about the role that dental, oral, and craniofacial research play in the health of our nation, and also how this research complements other research areas. So some of the offices that you'll be meeting with tomorrow are likely very familiar with this work. But for others, particularly if you're meeting with a freshman member of Congress, they may be less familiar with this subject matter. And that really just means an opportunity for education. Either way, you should really see these meetings as opportunities to raise awareness about your work and your research to set yourself up as a resource for members of Congress and their staff, and to begin building relationships with these offices if you haven't done so already. And then beyond that, from kind of a broader perspective, it's important to remember that having a vocal base for federal agencies and programs is critical. Generally speaking, non-defense discretionary funding, which covers really virtually everything outside of defense, including scientific research and education, is more vulnerable during the appropriations process. Recent history has shown us that when there's an increase in the deficit, the subsequent move from Congress is to take steps to cut discretionary funding. So particularly with the extra money that's going toward COVID-19 relief packages, we need to continue to carry the banner and making the case for federal research funding, and specifically for federal oral health research programs. And for members of Congress, it's most important for their constituents to make that case. So in the absence of you speaking up and speaking out about this work, members of Congress will think that they can cut these programs without any real ramification. So your presence on the Hill is really vital. Fortunately for NIH, we're in a good position and we experience bipartisan support, but we should in no way become complacent given the political and fiscal environment in which we're operating. So building off of that, we want to urge you to tell your stories tomorrow. You have a constitutional right to advocate on public policy as a citizen, and that advocacy really makes a difference. So when you go to the Hill, lean into your subject matter expertise and share your personal and professional experience in this space. Your story is powerful, and it's often what resonates. There's a saying that we like in Washington that data makes you credible, but stories make you memorable. So if you can find that balance, it's really helpful and effective in congressional meetings. And if you need any more convincing about kind of why we're doing this and why we're here, this is a pretty telling graphic from the Congressional Management Foundation. It's a little older, but it's still relevant. So this was pulled from an online survey of congressional staff. And what the graphic reveals is that most of the staff surveyed said that constituent visits to the Washington office being Zoom this year, to the district office, have either some or a lot of influence on an undecided member, more than any other influence group or strategy. So it's really important. And then now we'll move into some of the asks that we'll be making on Capitol Hill tomorrow. This is kind of the overarching key message. To continue building on scientific progress, Congress must provide robust federal funding for the entire health research enterprise, including NIDCR and NIH, and the health agencies that demonstrate the promise of research. Now I'll go over some specific numbers that we'll be requesting, and I'll note that our specific asks, we do not expect you to memorize these numbers. We have included them in your materials, which I'll review later in the presentation. At this point, we're really going over them so you can become familiar with them and why we're requesting these amounts this year. So for the National Institutes of Health, we'll be requesting $46.1 billion. This is the community ask for the NIH, and then a proportional increase of $520 million for NIDCR. The rationale for these asks: the NIH request would allow for NIH's base budget to keep pace with the Biomedical Research and Development Price Index, and also provide meaningful growth of 5%. So we applied that same math to NIDCR, reflecting, as I mentioned, the proportional increase to the NIH request. The NIDCR request also has the support of the oral health community, and it signifies the needs of the dental, oral, and craniofacial research community. We'll also be seeking $29 million for CDC's Division of Oral Health. And the rationale for this number is that it would give the Division of Oral Health support to expand beyond the 20 state departments it currently assists in their efforts to decrease dental caries, oral health disparities, and other chronic diseases. For HRSA, we'll be seeking $46 million for the Title VII oral health training programs within the Health Resources and Services Administration. And the rationale for this is just so it would allow HRSA to continue supporting pre-doctoral and dental hygiene programs, advanced dental education, faculty development, and dental faculty loan repayment for general, pediatric, and public health dentistry. And I will now turn it over to Erin to go over how to make your meetings as effective as possible tomorrow.
Thanks, Lindsay, and it's great to see everybody virtually. We're super sad not to have everybody in person this year in DC, but hopefully you guys have fun in your meetings tomorrow. And Lindsay mentioned how important it is for everybody to be doing this. So a huge thank you to all of you. For those of you who might have hopped on a little early, you saw that we were doing a quick training and overview for some of our group leaders. So I'm going to walk through some of the run of show and logistics pieces for the event tomorrow and meetings tomorrow, hoping that we have lots of time at the end for questions. But know that we've done a little bit more of a deeper dive on run of show and what to expect with your group leaders. So hopefully if you have questions, they should be able to answer some of those as well. In general, the group leaders will open the meetings for everybody. And the hope here is that you guys will have had a little bit of time to coordinate your speaking roles ahead of time. So the group leader will start the meeting, thank the staff person for joining, let everybody go around and do a quick round of introductions, just name, organization, where you're from. And then the group leader will sort of tee up the personal stories. So this run of show, sort of assumes multiple people in a meeting. There are instances where it might just be you or you and one other person. So you guys can adapt accordingly and spend a little more time on those stories if you don't have others in your meetings with you. The group leader is sort of tasked with making the asks, but I will say that this doesn't all need to fall to that person. If you guys want to tag team on the asks, that's fine. Lindsay's just done a good job kind of walking through them at a high level, and you'll have those in front of you. So, the only thing I might say tonight is, as you think about your stories and how you want to present the patients that you work with, the research that you're doing, the different things that you think will be meaningful to the congressional staff, think about how they relate back to those asks that Lindsay just walked through, and maybe tell the stories accordingly. Then you'll want to make sure to ask if the staff have questions. This is really, information for them. So spend some time just making sure that you've answered all of their questions. And even if it seems like, the meeting is kind of running behind, or you guys have spent a lot of time talking, I find that asking the staff if they have questions is a good way to kind of regroup and figure out, where everybody else is. They could have questions on some of the asks that you've just outlined. They could have questions, on some of the stories that you've presented. The staff, as Lindsay mentioned, will have some of the materials ahead of time. So they might have specific questions on asks, and you might say, how did you know that? Or where'd you get that question? They will have some of our materials up front in a link in the calendar invites as well. So just be aware of that. We're going to talk through the materials at the end of the presentation as well. Thank the staff, obviously, for their time, for taking time to talk to you. You will probably get the sense from some staff that they're incredibly busy these days. Just like all of us, it seems like life in Zoom world is even busier than life in real world. So the congressional staff are taking 10, 11, 12, maybe more meetings in a day. And so I think reminding them that we're appreciative of their time is very helpful. And they'll likely do the same of you. They'll be respectful of your time in the same way. And then there'll be important follow-up opportunities. So group leaders have the role of circling back with Lindsay or myself to share any feedback from the meeting. But it's important for everybody who's in those meetings to think about what questions did you hear, what things came up that you guys couldn't answer. And you can sort of circle your wagons back with your group after the meeting and make sure that all of those points get back to us, because that is how we do the best we can to follow up for AADR as the year moves on. And then you'll just send a thank you note to the staff for their meeting as well. Sorry, you can go, Lindsay. So keys for effective, I don't even know how to say it, but when I wrote it, it seemed really good. Communication. So, this is hopefully just to get everybody smiling. It's a bit of an unfortunate situation to not be in person, but it is the best sort of option that we have to be able to do these meetings by video. We get a lot of questions, how many staff will actually join by video versus phone? It's pretty hard to predict, but I would be prepared for video meetings All of the staff have been sent the Zoom link, and we've kind of, if folks ask us for a conference line or another way to dial in, we'll provide that. But for the most part, you know, I think we're seeing more and more Hill staff join some of these meetings by Zoom. So hopefully you'll see them in person, or as in person as we can be. But that's one thing to think about. Identifying speaking roles ahead of time. Just if you do have, some of the groups from certain states have probably 5 or 6 people in them, which is going to be hard for everybody to tell their story. So just figure out, you know, who wants to talk about what, or how you guys are going to divide and conquer in that 10 minutes that you'll have ahead of time, which we'll get to the run of show logistics in just a second. Tie your stories back to your state or district, right? So the asks that we have are national, but certainly the implications for the members that you'll be talking about or talking to will be really for what's relevant to their state or district. How does this money, how does this funding impact you guys in the state? Find a way to relate to the staff, right? Everybody's been to the dentist, so you can have a common ground and starting place there to tell a story or to talk about something. We don't need to go in assuming that they don't have any idea about our issues. Remember to take a pause, right? So when you're talking on Zoom, we do it all day long. We sometimes forget to just stop and take a breath. And so I think that's something in these meetings in particular that will also help everybody kind of regroup. Don't be afraid of that pause. We talked about asking if they have questions. I just like to put that lots of places because I really do think that some staff are hesitant to interrupt and ask them as you guys are talking. So just be cognizant of that. Time management, we've talked a little bit about that as well, expecting about 15 to 20 minutes per meeting. And it's, you know, kind of on you guys to wrap up in a timely fashion. You know, if you're in a situation, happens occasionally, where the staff are asking lots of questions or the meeting's going great and they're not wrapping things up, and you guys have another meeting, that's also appropriate to say, you know what, we really appreciate your time and thank you so much for being so generous. We actually have another meeting at 3 o'clock, so we're gonna you know, start to wrap things up and want to be a resource to you going forward. Is a great way to get out of a meeting if it's going too long. It's okay to say, I don't know the answer to that. You can always write down that question and circle back with Lindsay or myself, and we will figure out the answer or try to do the best we can to get a response back to that staff person. And then I just always like to remind people, you know, these meetings are not meant to be partisan. You might meet with members of Congress who are from a political party that is not the same as your own, and that's okay. You need not bring that up. And I think it's important, you know, in today's sort of hyper-partisan world to remember that a lot of these issues that we're talking about are bipartisan. NIH has great support from both sides of the aisle. And I think you might hear some partisan messages from congressional staff who you talk to. We just had a very partisan package pass Congress to support COVID relief. But it really only passed with Democratic support. And so you could hear Republican offices bring that up in a negative fashion. And I think those are just kind of things to stay away from if you can avoid those topics or not respond or dig in on them. So let's talk a little bit about what to expect just from a purely logistics standpoint. We got a lot of great questions about this in the leader training, and I want to make sure we have plenty of time to answer your questions. So your actual meetings should all be on your calendar by now. You were sent an email with the calendar invite for the actual start time. So we're going to ask folks to try to hop on 10 minutes ahead of that meeting. Just do so knowing that your group leaders are going to do the best they can to get there 10 minutes ahead of time. We have a few meetings that do run back to back, so they might be pulling themselves out of another meeting, but more often than not, you'll be with them the whole time. So you also would be pulling yourself out of that other meeting. And if it's a second meeting, the hope is that you would have a chance before your first meeting in that back-to-back series that you guys could kind of convene and say, okay, we've got 2 in a row. You know, here's what we've got to do to be prepared to get through both of them. And once you do one together, hopefully you guys will have this down to a science. Then as soon as you've been chatting for 5 or 10 minutes, you'll welcome the staffer when they join your Zoom room. Expect to talk for about 15 or 20 minutes. We've talked a lot about time management, so I won't spend too much more on that. But important to note that everybody does have unique Zoom links for each meeting. So you do need to check your calendar. And if you are in a Zoom room with the same group heading to another meeting together, just like if you were on the Hill, you got to leave that room and go into a different one. So don't get too comfortable waiting there for the staff to arrive. You'll have to walk yourself to your next meeting down the hall. If you have any questions, there are contact information on this slide. There are two other folks, Lindsay and James here are the kind of main points of contact for tomorrow. My email's on the last slide, as well as my colleague Meg. So between the four of us, you should be able to get to one of us. And we will all be monitoring everything throughout the day. James is responsible for all of the scheduling. So if you saw the calendar invites coming from him, that's why. And he'll be our main liaison back and forth with congressional offices if any schedules change. So we'll do the best we can to reach out to you if we have any last minute scheduling conflicts or changes. And I think with that, I'll turn it over to Lindsay to talk a little about the materials, and then we'll take questions.
Yeah, so a few final things to go over before tomorrow. So you may have seen in your Know Before You Go email that we will be holding a Hill Day kickoff event tomorrow at 11 a.m. The link to join that meeting is on the Hill Day website, which is included in your chat boxes. So we encourage you to join us for that. It's just one final opportunity for you to hop on, ask questions. We'll review the asks one more time. We have some remarks from Representative Simpson that we'll play before we leave. But really just an opportunity for us to gather one more time before you go on your respective Hill visits. There are also several materials available for you on the 2021 Hill Day website. So I encourage you to get familiar with that page and take a look there today. First, we have a social media and communications toolkit. We encourage you to be as active as possible, both today and tomorrow during Hill Day. We have sample social media messages for you to use. We encourage you to tweet about your meetings, tweet at legislators tomorrow, thanking them for their time. We're using the hashtag AADRFNIDCR Advocacy Day. That's also in the chat. We know it's kind of long, but hopefully it'll populate quickly once you've used it once. We also have a Why I Advocate sign. So it says Why I Advocate for Dental, Oral, and Craniofacial Research. And we would love if you would either print out a copy of that or just fill it in digitally and post that on social media so we can see why you're going up to the Hill and why you're advocating for this research tomorrow. We also have a Zoom background created that you can use for your Hill Day meeting. So that's also in the social media and communication section of the Hill Day website. We also have a list of talking points. I'll note that they're very comprehensive, but as I mentioned earlier, we really want these meetings to feel authentic and natural to you. So that's really something that you can use as a reference and as a guide. You by no means have to say everything that's on that document. As Aaron mentioned, once you get in these meetings, you do a meeting or two, it'll start to feel really organic and natural. You and your group members will find a rhythm, but certainly feel free to use that if that would be helpful to you at all. And then finally, there is a link for a briefing materials webpage. And this, I'll note, is both for you, but also for the congressional staff that you're meeting with. So this link was included in your Zoom calendar, email calendar invites. So it contains the documents that you can use for reference tomorrow. One of the documents that's included is our just general fiscal year 2022 funding requests. At a very high level, it outlines our asks for NIDCR, NIH, CDC, Division of Oral Health, and HRSA. So feel free to use that document as you're going through the numbers and the funding requests. We also included a Friends of NIDCR fiscal year 2022 sign-on letter. This is just a coalition letter that has support of organizations that are endorsing this fiscal year 2022 number. So feel free to reference that during your conversation with staff. And then we also have a one-pager outlining NIDCR's role in COVID-19 research and some of the ways that they're contributing to the knowledge base on COVID-19. So all of the briefing materials are available from the Hill Day website page this is the vanity URL for it if you need to access it a little more quickly. But like I said, everything can be found from that main landing page. So take a look through all of that and make sure you've got the information you need. We also have several state-specific one-pagers. So it talks about how much NIDCR has funded in each of the states. We have most of the states represented, but there may be 1 or 2 states that aren't included. So if they're not, let me know, and we'll try to get something put together for you quickly. So we do want to provide time for questions. This is the contact information for pretty much the whole AADR government affairs shop. If you want to screenshot it, you can reach out to any of us today or tomorrow with questions. We'll be monitoring our emails, so we'll try to get your questions answered as quickly as possible. But with that, I will pause, and Aaron and I are happy to take questions from you all. So maybe what we'll do is, if you want to use either the raise hand function, or if you just want to raise your hand or type something in the chat box, we'll try and catch you all. Pamela.
Unmute. There we go. Good afternoon. Hello, everybody. I was just wondering if you could advise us how to get our stories together, or what advice you would have. And we're going to have 10 minutes to do this before the meeting. So how would you suggest, what sort of stories work? I mean, I'm not a clinician. I don't have really good patient stories. I have some research stories, but I don't know if you have any examples for us, or.
So I can jump in first, and then Lindsay, feel free to jump in too. I think the first thing I'll say is think about, you don't feel like you have to plan your whole story in that 10 minutes with your group. So think about your own individual experience in dental research and what sort of you bring to that, to the research field. A story can be anything from, this is the type of research I do and this is why it's important. It doesn't have to be a specific story or a moment in time. So I use the story term kind of broadly, but it can be, I'm a researcher from the University of X, and I've, focused my career researching craniofacial deformities, and this is sort of my area of expertise, and this is why that's important. Do you know what those are? And you may get some inquiries then to sort of talk about why that research is important, and the fact that you get a lot of your funding to do that research through NIH or other US government agencies.
Great. So we can kind of get our cue, take our cue from whoever we're interviewing or speaking with, actually. Okay.
Exactly.
Thank you. Thank you.
Mark, I see your hands raised.
Thanks, Lindsay. I just have a quick question. So I noticed on a couple of, or actually on both of my meetings, I don't see anybody else listed besides myself or our IPPF advocates. Does that mean that we're on our own? And if so, we obviously need to study up on the fiscal year ask.
Do you want me to take this one, Aaron, or you want to take it?
Go ahead and get started. It looks like you were about to start, so I don't want to interrupt you.
Zoom, challenges of Zoom. Yes, Mark. So if it was only you and IPPF advocates, then you will be the only ones in that meeting. But we always, the patient perspective is incredibly valuable during these meetings. So really just talking about how, for your story, how the federal agencies are supporting IPPF's research portfolio. But certainly, don't feel the need to hit every single federal research agency. You can point to the document for that funding, but really talk about the group that you're most comfortable with and that you work with most directly, so that, again, the conversation is really organic and natural to what you all do day to day.
Great. Well, all of our advocates just did this last week with the Rare Disease Week, so I think we'll be okay. I just wanted to make sure before we. Yeah. It wasn't going to be anything else. Great.
There's a couple questions in the chat. I'm going to make sure you're not missing those.
Okay. There was a question about will we just be meeting with congressional staff, or could a member of Congress join? It will likely only be congressional staff, but I wouldn't rule out, if a member of Congress has time, they may pop on, but I do not think it's likely. So I think it'll just be congressional staff.
And we haven't gotten any indications. Sometimes they give us a heads up if the member is going to join, but we would certainly, if we found that out, try to get that out to the group ahead of time.
I also see a question, how do we know if we're a group leader? If you were a group leader, you should have received an email from me last week. But if you have any questions or just want to confirm, feel free to reach out to me. Tanner, I see your hand up.
Yeah, I just wanted to confirm that the meeting time invites that we have, those should be in our own appropriate time zones, right?
It should adjust.
Yes, it should technically adjust based on how you have your calendar set up to accept meeting invites. It should automatically transfer to your time. But if you have any questions about the actual times of your meetings, you can let me know.
I also see a question, if we are the only person, then I assume we're our own group leader. That is correct. But I'll note, if you are in a meeting by yourself, we worked hard to make sure that no one was doing meetings alone. If you're uncomfortable doing a meeting by yourself, then email James and you can copy me, and we will try to arrange so someone can go with you. So just send us a note if that makes you uncomfortable. Hopefully between the talking points and the materials, you feel like you're equipped with everything you need to have a successful meeting. But if you're uncomfortable, please let us know. Do not see any other hands raised. Any other questions?
Lindsay, I have a question. So
Yes.
how do we, why did you create a white background? Look at my background now, see? So I think that your blue, I kind of feel that your blue background, I mean, is there any symbolism on the white background, or can we change it to blue like yours?
I don't know if we could change it at this point. I will maybe
No, it's fine. I mean, I can play and be creative, but I'm not asking you. But I wonder if, don't you find that the white is a little bit creepy? Like, look at me now. It sounds like it looks like I'm a ghost that comes out from this white background.
I think we did that because the Friends of NIDCR logo is on a blue
On
background.
white. Okay, so I leave it like this. Okay, it has a meaning then.
Still in our color palette, but maybe we'll note it for next time. We'll try and do
Okay.
Any other questions? Okay, seeing none, I will just, oh, Jacques, go ahead.
So I thank you, Lindsay and Erin, for putting this together. I just noticed that in one of the meetings that I have, I meet with a legislative correspondent and with a legislative assistant. Can you tell us the difference between those two roles that they have?
Yeah, that's a great question. So traditionally in Senate offices, they have a little larger number of staff people who work on each issue. And so a legislative assistant is usually a little bit more senior of a person who works on a specific policy issue, whereas a legislative correspondent does what the description might sound more like corresponding with constituents and sort of back and forth communication. So a lot of times the legislative correspondent is a stepping stone to a legislative assistant or LA position. In House offices, the legislative correspondent position is a little less common. And in most cases, you'll have a legislative assistant, and this is actually interesting, who works on probably anywhere from 5 to 10 policy issues. So it could be that they don't just focus on healthcare issues, but they focus on other areas. Maybe they focus on education, other issues across the appropriations portfolio. So that's a great question.
And just kind of a quick follow-up, and how do they communicate with the a senator in this case, for example? Do you expect they have a debriefing with the senator from what we talked about, or in general terms, or what's next after we talk with these folks?
Yeah, so every office handles this a little differently. Some offices will debrief, I think, a little more regularly, and the legislative assistant might have a direct line of communication to a senator or representative, but more likely they're working through what's called their legislative director, and that's sort of the policy position in the office that oversees the staff. So offices are sort of organized. You've got the member of Congress, you've got a chief of staff who oversees all of the different policy areas and oversees all of the staff and the administrative issues. And that person often interacts with committee assignments and things like that. And then you've got a legislative director who's responsible for the policy and legislative portfolio. And that person, in a lot of cases, is sort of where the legislative assistants or individual policy staff would report and sort of share their experiences. For what we're working on, you have a really good question on how do decisions get made about what they prioritize, right? Mm-hmm. So right now where we are is congressional offices are taking meetings with and hearing from constituents on what their priorities are for the fiscal 22 appropriation season. And then those offices, every office sort of compiles their priorities. And so they're going to look back at all of the requests that came to them through the appropriations process, through groups like you guys, through constituents, to sort of decide what their priorities will be. And individual offices will then submit those requests to the appropriations committee members. And so it's that process that we're really trying to influence now by seeing them in March, because those committee deadlines for accepting the requests are April 14th. Okay. And so we're right on time to sort of fit into that process.
Perfect. Thank you.
I also received a question about whether or not staff received the briefing materials. So the link with the briefing materials was included in the Zoom email calendar invitations, but during the conversation, we encourage you to remind them that the link with the materials for today's conversation was included in the Zoom calendar invite. We encourage you to take a look at that so you have easy access to that information. So make sure they know it's there, because it could have been buried. And then I saw a note about only a few states being included. We included most of the one pagers that we included were the states that we already had created. There may be some that were missing, but if your state is not included, let me know and we'll try and get something created for you and up today. Any other questions? Okay, well, I have included email addresses in the chat box, but also available on our website. So if you come across any other questions before tomorrow, please don't hesitate to reach out to us and we'll get back to you as soon as possible. Thank you all so much for taking the time out of your days tomorrow to advocate for this research. It's really important. I know Zoom's a little different. We all wish we could be together in person tomorrow. It's a lot of fun whenever we all get to go up to the Hill and collectively advocate together. But even though it's over Zoom, it's still really impactful. So we appreciate you all taking the time. You all are really the best champions for this work. So thank you so much. We look forward to hearing how your meetings go tomorrow, and we look forward to seeing you during the kickoff event at 11 tomorrow. Erin, any final comments from you to wrap us up?
I was just going to say, tomorrow at the kickoff event, if you guys want to think about your stories tonight, I'm happy to do a practice run tomorrow with anybody if we want to sort of role play a meeting or do something like that. We'll have a little bit of extra time. So it's mostly to get us excited and feel ready for our meetings.
Yeah, Erin and I will stick on the kickoff event for a little while tomorrow. So we're happy to go over anything else that might have come up tonight for you. Okay, and with that, I think we can adjourn. Thank you all, everyone. Have a great night.